Let's see a case scenario on diabetes. So it's a scenario that Miss Lisa, an 8 years old girl, recently moved from another state, and she has been evaluated in the primary health clinic with a severe thirsty and hunger, and the previous medical records were not available. And when they were evaluating the family history, her mother is telling about Teresa has been tired and always she has the feeling of thirsty. And from the family history, after collecting, her father has been diagnosed as having type 1 diabetes, and so the doctors they were suspecting these nurses whenever they are assessing, they are suspecting Teresa also may have type 1 diabetes, and the doctors ordering a plasma glucose level. And the result shows that the plasma glucose level was more than 120 milligram per deciliter. So they have, after seeing the plasma glucose level, they have advised for additional blood test, so that the blood test include islets of antibodies and insulin auto antibodies and glutamic and decarboxylate. And after confirming that the Delisa has type 1 diabetes by the presence of, because there was a presence of antibodies, and doctor scheduled the follow-up visit. And during the course of visit, the doctor counseled Lisa and mother and told them the Lisa has type 1 diabetes. So here the test plan, this means the body is no longer is able to produce insulin. So it may be caused due to sometimes maybe genetic disorder or due to hereditary factors or due to some autoimmune disorder. So she must take insulin from now onwards. And they have recommended that Lisha to be started on conventional insulin therapy, which involves she has to take insulin both morning and evening. And they have explained to Lisha's mother so about her health condition. So they have to keep the amount of carbohydrate consumed and the carbohydrate restriction, and she has to eat the diet plan they have explained, and she should eat at a close as possible on the same time each day. And they have to maintain a diet plan, and they have to monitor whatever the diet she is taking. And they also refer Lisa to a registered dietitian for help in meal planning as the family becomes accustomed to working with the disease. Here, as planned the Risha may, so she may develop them. So that she may be going through a honeymoon period during which time her insulin level decrease for weeks or possibly months after starting treatment. So they have insisted about the importance of checking blood glucose level, and they have recorded the blood glucose level and adjusted the dosage of insulin. And 6 months later, Lisa developed a 2-day history of fever, malaise, and diarrhea. And at that time, she was well hydrated, and her physical examination was normal. And when they checked the urine for ketone bodies, the ketone body was positive, and the blood glucose level again it was risen up to 260 milligram per deciliter. And even the electrolytes, included bicarbonate, were normal. And the question is now, in addition to providing supplemental insulin, which is the most appropriate management of this patient, anyway, she is getting morning and evening insulin. So, addition to that, what are the appropriate management we have to do? Whether we have to hospitalize to her immediately, or we should check her to do the blood glucose once a day, or we should instruct her to check her urine routines once a day, or we have to instruct her to drink large amount of sugar-free liquids. The best answer is D. She has to take large amount of sugar-free liquids. So children with diabetes are not immune. So it may be caused due to some infection or family history or some immunodepression or some genetic disorder. So here the primary goal to manage diabetes is to prevent occurrence of hypoglycemia and diabetic ketoacidosis. So normally we will say the blood glucose level falls less than 50 to 60 milligram per deciliter, that is hypoglycemia. And when children fall sick, they almost require extra insulin in addition to the routine dose. So the recommended children blood glucose level will be every 4 to 6 hours on 6 days. And drinking large amount of sugar-free liquids also will help to prevent dehydration, because one more thing, dehydration also leads to diabetic ketoacidosis. So always young children should ingest approximately 3 to 6 ounces per hour, or adolescents should drink 6 to 8 ounces per. Thank you.